who works for both Hertfordshire Council and Eastern North Hertfordshire Clinical Commissioning Group, which makes decisions about local healthcare services. His organisation was actually praised in the report. Thank you both for coming in. Phil, first of all, just give us some of the key headlines for the report and where the elderly are being let down.
I think it's a question of the NHS failing older people. I think it's about the fact that we have an ageing population, very different needs to when the NHS was set up in 1948, and it's about how we respond to an ageing population, one in which people have more complex conditions, and it's about getting the care in the right place at the right time for them and making sure that we're keeping people well at home and supported at home for as long as possible, that we have the right balance of community services, but absolutely that when they need hospital care, that they have access to it and they have support and they go into hospital and receive the right quality of care, but are also then supported to come back out of hospital and remain out of hospital and living at home and in their care home. I
mean, it sounds like a pretty obvious wish list, and it's not something that hasn't been said before. Why is it that we get successive reports and it seems that nothing changes? What do you think will happen with this report?
I think what we've done is we've identified over a series of reports and a series of commissions a series of problems and a series of issues. And what we do in this report is we've gone out and we've looked at where are the really good examples of where care is being delivered in the right place, so in someone's home, what's working well in terms of community services, what's working well in care homes, but also what's working well in hospitals. So we've got some really good examples of where we're changing the way that we deliver NHS services. For example, in Sheffield, in the Royal Berkshire hospitals, what we're seeing is consultants seeing people at the earliest possible opportunity when they go into the accident and emergency unit, and that changes the way that they experience services, because they'll either be discharged much quicker, or they'll be admitted and the package of care that's put together will be the right one for them.
And Chris, Hertfordshire has been singled out in the report for praise. Why? What are you doing particularly well?
Well, we're looking at both the NHS care that's delivered to people, but also the social care, so care that's delivered to older people for making meals, getting dressed, being washed and so forth, and looking at how all those different professionals can work together, whether it be a nurse, a physio, and forgetting about which organisation people work for, but looking at what are the needs of those older people and how can we meet those. And I think critically important.
So give us some really clear examples then of things that have been done where you are, which aren't being done elsewhere.
So we've started working with our care homes to make sure that there's a single GP linked to each care home that goes round and does equivalent to like a ward round, but in a care home, to make sure that issues that might crop up with those patients and dealing with them as quickly as possible, so that those care home members of staff are supported to care for those individuals in the care home, to stop them having to go to A&E unnecessarily. And we've got teams that will respond within an hour of that care home giving them a call to get those services and specialists to the care home really quickly, rather than that individual having to go to hospital when they don't really need to.
And that sounds like a simple thing to do. Is it expensive?
No, it's not. It's actually cheaper in the long run. If we can get the services lined up in the community and avoid people having to go into hospital, we can keep hospital for people that really absolutely need to be there, which is quite an expensive resource. So it should be something that's both better care for the individual, because they're treated in their own home or in the care home, and saves the whole system money, both social care and the NHS.
Any other examples of things you're doing particularly?
Well, one of the things we're doing is looking at loneliness, which we think is a big issue. Over 2 million people over 75 live at home. In Hertfordshire, we've actually supported Age UK to get a number of volunteers to befriend people that are lonely or on their own, either when they've left hospital or when they're in the community, to give them some support, some company, because we know loneliness can be a real problem in terms of actually making people unwell, stressed and worried, and actually just someone to come and talk to them, make them a cup of tea, can make a big difference, but doesn't actually cost us very much.
And what impact has that had?
Really big impact on those individuals, so they're not coming into hospital nearly as much. We're also able to support people leave hospital much more timely fashion, because actually we know that we can have someone from Age UK that we're supporting, a volunteer, go and maybe turn the heating on when they get back, buy them some milk, and just give them those little things that make a big difference to people.
How come Hertfordshire is doing this where others aren't? I mean, where did the drive for this come from? Was it one particular individual in Hertfordshire who said we need to
really focus? We've talked to patients and people that use our services in social care in the NHS and asked what they want, and actually what things, and we sometimes overcomplicated it, and actually just doing some of those simple things around social contact, getting professionals from different organisations to forget about their